Good afternoon, everyone, and we'd like to welcome you today to the Flint Community Webinar on Coronavirus. This is April 15th, 2022, and this webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. Again, we're so excited that you joined us today. And today is a very special day, and I'm glad to be your moderator, Yvonne Lewis, one of the co-directors of the Healthy Flint Research Coordinating Center. And there are a number of initiatives we're working on in the community, so we're glad that you're here to help us get a better understanding of how these initiatives can be helpful to you. We do this work with an array of community partners. Of course, no one in our community can address all of these issues alone. So we certainly appreciate over this 109 weeks the partnership of all these community organizations who come on a regular basis to answer questions for you, to provide relevant information, and to do our best to ensure that we are responding to you in a way in which you can take this information and use it in the community. Importantly here for us is that we started looking at this as a pandemic and said, how do we make this, provide this information so that there is a local context to this global pandemic? And so every Friday for this last 109 weeks, we've been excited that you've joined us here. We do have a little skeleton crew today because this is a special day in a Christian holiday calendar where many are observing in special ways Good Friday. And so we thank you who have taken this time out for this hour to spend in a way that we can give honor to those who we are respecting today in terms of this observation of this day. Today, our program will focus in on how do we reframe this conversation around COVID. We're looking at discussing from pandemic to recovery. That's a huge conversation that's going on now. We'll have a presentation about advanced care planning, which is critically important for all of us to think about. Of course, you're going to be excited about hearing our medical moment. And then we'll have updates from the city of Flint as well as from the Genesee County Health Department. We want to acknowledge this month, the month of April, is National Minority Health Awareness Month. And the theme for this month is Give Your Community a Boost. Now, we recognize this is focusing in on increasing vaccinations, both COVID vaccinations and other vaccinations as well that we've been talking about. But we want to also say, give your community a boost by boosting out information that you know is relevant to our community, that will help those who may not be here with us today get a good understanding and be able to make some informed decisions. So Minority Health Awareness Month helps us to elevate those issues that we have seen over the years, but really want to give some attention to during this month. In addition, this week, in keeping with Minority Health Awareness Week, April 11th through April 17th is Black Maternal Health Week. And I'm not sure how many of you are clearly aware that the rate of deaths among African-American women is increasing after birth. So we want to make sure, we call it maternal mortality in African-Americans is increasing. And so we want to really be sure that we address this issue. We have wonderful organizations in our community that are doing that. And I want to lift up one is Revive Community Health Center, focusing particularly on African-American women during their pregnancy and beyond. So April 11th through 17th is Black Maternal Health Awareness Week. Now, today, we just want to take a few minutes. And as I said, we've got a skeleton crew, and I'm glad to see Dr. Deborah Holden and Dr. Wolford here with us. Just want to take a few minutes. Dr. Deborah, and I'm going to give you some new titles today, but you're here today with us. Let's talk a little bit about, I'm saying reframing this conversation. And I want to weave these two, reframing this conversation around this global pandemic, moving from what we call crises or emergency to recovery. Now, this is a big conversation across the nation. CDC has changed its guidelines, even though some of them are really pretty much the same. It's kind of buried a little bit, and relax them because people want to get back to business as usual. What say ye about this?
Well, I'm physically parked in New York City right now. And you know, there's a bit of the language is getting cuter and cuter every day. What we used to call a surge, now we call an uptick, a slight increase, a small bolus of cases. I just remind people we're very much still in the pandemic. That's the thing that I think people need to understand. We've got the multiple layers of protection. The vaccine still forms the foundation of that, the very basics of good hand hygiene, masking in crowded indoor spaces, all of those things we need. And I tell people, just because the CDC will eventually peel back the recommendations that you mask on a plane or on the subway and in those kinds of spaces, it doesn't mean that the most important layer of protection, which is this thing in between your two ears that God gave you, shouldn't be activated. So I encourage people to still keep those things in place for themselves, despite what's happening. I think there is a bit of a rush to normalcy, but unfortunately, while we might be over COVID, COVID is not over us.
I think that's a really critical piece, because one person said to me, well, it's not in the news anymore, so maybe really it was a hoax, and maybe there really isn't anything to it. I'm just so concerned that even though we don't see it in the media the way it was, that we really reduce our own way of really recognizing that this is still a very serious issue.
Yeah, and if you talk to the more than 1 million people, loved ones of the more than 1 million people who died, the 150,000 kids who've been orphaned during COVID, they would tell you something very, very different. And something that I haven't shared publicly with very many people is that when I had my second COVID infection in late November, early December, it was a very mild case. I had kind of a bad headache for a day or two, a scratchy throat, fatigue that was really, really bad, but only if I exerted myself. So my solution was to not exert myself. And I basically just sat in bed with my TV tray and my laptop, and my son brought me chocolate ice cream and took good care of me. But in the 2 to 3 months that followed, I would be, even on this Zoom, I would lose my train of thought sometimes, well more than I had before. I started keeping little pads, these little yellow pads next to me, because I would raise my hand on a Zoom. And by the time they came around to ask me what my question was, I had forgotten it. And it took me a while to reconcile. And I finally started talking with other people about it. This is what they mean when they say that brain fog that people will suffer as a symptom of long COVID. And it was hard for me to wrap my head around that I was maybe suffering from that. But I realized what I'd done is I had put all these strategies in place to try to overcome that, because I couldn't accept that I had done something, that had placed myself in a position where I might be dealing with these symptoms long term. I've since gone and learned a lot more about long COVID and other people who have similar symptoms to myself, even people in our own community who I won't name because they didn't give me permission to share that. But I know a fair number of people who dealt with that, who had what seemingly was a mild case, but the long-term symptoms that they deal with, whether it be, I know somebody who's having kidney problems, somebody who continues to have breathing problems, many people who talk about brain fog. So this is the kind of thing where the goal is not to sort of brush it off and pretend as though it's not a big deal. The real goal here is to prevent people from getting sick in the first place. And I think there's a better balance between how do we take what we know works as far as prevention, both at the individual level and then at a community and a system structure policy level, and get all those things activated so that people can be more engaged in their world, but also not unnecessarily placed in harm's way.
Right. So to that point, that's why these conversations are so important, because we're continuing to learn. I've said over this whole thing, we're in a global experiment.
Yeah.
None of us really know. This virus is it's not that we have a new virus, because some people say we've had SARS before, right? But it's just something unique about the way this virus, I call it, is organized, and the way it really impacts our bodies, because it does impact people differently based upon what's going on inside of them. That's why we said early on, keep your immune system built up. That's still a very, very critical thing. But as we go through this reframing, where everybody was at this heightened sensitivity, and now it's more nonchalant, the language is changing. When you talked about the bolstering, what are you, little surge and all of this? Oh my God. How do we keep
I think that's the cutest word of all, an uptick. Because what they call an upticks for in some places, the steepness of the curve, the slope is the same as it was in periods where we called it a surge. But we're softening the language because I do, and I love how Katie has talked about this so much, just the tremendous mental health impact and the toll that this has taken on people mentally and socially and emotionally. Like, I understand it, but that's why I think things like this webinar are so important, and the power of the local trusted, credible messenger, like the Health Coalition, like the Genesee County Health Department, is so important. Because if you want to understand trends, and I just want to give a big shout out to Dr. Rick Sadler and our fabulous partners at the Genesee County Health Department for this really amazing Genesee County COVID data dashboard. You can go in there. It's intentionally designed for people to be able to go in without a lot of education, no skills, no training, to be able to go in and interact with that. It automatically gives you statistics over the last 5 weeks. You can tell it what period of time you want to look at. It can give you stats, and you can see the curve in Genesee County from the beginning of the pandemic up to and including about 7 days ago. You can look at that data by race. You can look at that data by gender. You can drill down and say, I want to look just in the city of Flint, or I want to look just in Grand Blanc, or I want to look just in Fenton, or just in Burton. You really want to understand what's happening locally in your own community, so you can maybe put it into context for yourself and make a better risk assessment for yourself. So if somebody says we've had an uptick in cases, and you go and look and you say, man, when we were at the height of the pandemic back in 2020, we had about the same number of cases that we have. How is that up? I mean, your own logic will likely kick in. So I think it's important to have dissemination channels like this, because we really are trying to help people make sense of things. And I will say our numbers are at an all-time low. We are doing relatively well. And there were periods where we were not, where the numbers were decreasing nationally, but they were actually going up in Flint, Genesee County, and in the state of Michigan. We're not quite in that case right now, but we do have to watch what's happening in other parts of the world and in other parts of the country, because in a way they're foreshadowing and letting us know what might be possible or what might happen here if we just get a few additional cases. It could tip the scales for us, and we'd look just like some of these other places.
Right. So one of the things you've helped us do with your epi hat on and that epidemiological hat, looking at these numbers and trends, is to help us understand this. And something that happened in this changing from pandemic to recovery is how we even look at the whole conversation around the pandemic. At first, we were looking at individual cases and case rates. And now they're saying we're going to look at hospitalization as a way to measure. When we talk about metrics, we're talking about ways to measure how we're doing our community. Can you tell us a little and explain to us a little bit about why these shifts in how we measure things?
Yeah, it's not science-based. So I'll just go ahead and say that, and I'll be bold and step out on the skinny branches. That's not science-based. The CDC is sold out to big business, in my opinion. That is my opinion. That doesn't reflect the opinion of any institution that I work for, but we say lead with the science, and they are not leading with science. That is not a science-based recommendation, in my opinion. Hospitalizations, if the vaccine is doing what it's supposed to do, we should see, even in a surge or an increase in cases, we should see fewer people getting severe illness, fewer people needing hospitalizations, and fewer people dying. And don't get me wrong, the excess burden that got placed on our hospital system was tremendous. We were on the brink of collapse, right? People couldn't, I was telling people I would not take my kid roller skating because this is not time for your kid to break an arm. You will sit in a waiting room for a day waiting to get a broken arm reset, because the emergency departments are overrun with COVID patients and patients with chronic health conditions that are going unmanaged because of COVID, and so, those recommendations to me they're not science-based. And I'm a part of a group called the People's CDC, where we are doing our very best to try to put science-based recommendations forward that people can lean to, that people can know are coming from people who have no agenda. I've been bought and paid for by nobody. I'm here and standing and calling and do what I do in service of public health, and at the first, foremost, and always. So I don't think those are science-based recommendations. I think it's political.
Right. So, and we know economics and politics play a big role in all this, but that's why it's so important. We want our community members to understand, please stay in these conversations. When there are opportunities for you to gather, and there are a number of initiatives going on in our community. We had Lydia Stars from the Community Foundation of Greater Flint talk to us about the NICE proposal, Dr. Deborah, that you helped get going here in our community, that provides resources to our community organizations to continue to be in this conversation, help us understand what the concerns are and how we as a community, we can't do anything about what's happening in other parts of the world, but how do we as a community address these so that our community can be healthy?
Well, I think the key and the thing I like about the NICE and the CDC funding of the NICE is that they recognize we've got to put money in the hands of people who are credible and already connected and doing the work in community. You know, we've got, as a part of the NICE project, we are in Holland, Zeeland, Michigan, which has a large migrant farm worker community. Many of those members in that community are members of the community, but they don't have all the documentation and the paperwork. So they're less likely to show up in some of these formal places and care settings for fear of deportation or other types of harm coming to them because they don't have all of their paperwork.
Right.
Many of them are not, English is a second language for them, or their English proficiency is low. And there's no judgment in that, because if you plot me in a Spanish speaking country right now, that middle school and high school Spanish probably wouldn't be as good as the English that they have with no formal training. So these are our brothers and sisters, but we don't treat them like our brothers and sisters. And NICE has been critical in helping to move the needle on those folks and making sure that they have access to the vaccine and that they are getting it in places and able to go or have people come to them knowing that they don't have to be in fear or at risk for some harm coming to them for trying to protect themselves and their family's health. So we know that the best people to do the work are the people who are already in community. And I just appreciate that there was at least this opportunity to put the resources where the work is actually needed and being done. Yeah. Whether or not we continue to work like that, we'll see.
But if we do a good job, we can push on that needle. That's where the collective community voice is going to make it just is so critically important right here.
And that's why the community academic partnership is important, because we are going to substantiate and provide the evidence. The last piece of this is to develop a promising practices toolkit that will have the science and the evidence behind this is the results that we produced. Empirically, this is how the needle got moved. This is what it looked like before. This is what it looks like after. This is what it looked like in communities where comparable communities where these resources were not available. There's a list of evidence-based practices and promising practices. And now much of the work that we've done will qualify because we've got the sort of academic partners working with the community partners to hit that bar and meet that threshold of proof to say, not only did it work, but this is how it worked. And this is how, if somebody else wanted to do it, this is what it would look like, right? Yeah. We're codifying and then disseminating that information.
So it's really exciting to be able to take the lived experience and then put some data with it. So all of our lived experience, what we're saying are you said promising practices, but then we understand that they're best practices, because this is what worked for us in our community. And we're able to put that out there for other people to learn from. So I'm gonna plug this one more time for our community members. This is a great opportunity. Let's not miss it. Be a part of these conversations. If you see that opportunity, let's seize it, because now we know we have advocates in the academic world who can talk to folks in the funding world to help us collectively make a difference. Dr. Deborah, thank you so much for this time. You hit on something though that I know is really important to you, and you talked about it, but you didn't say it, but that equity. Making sure people have access, because if there's no access, we'll never get that equity place, and we will never reduce these differences or disparities.
Yeah, and equity is more upstream, the systems, the structures, the policies, the bigger level barriers. Our minds immediately want to go to the individual level factors, right? Well, this group doesn't eat as well, or they don't exercise as much. Well, you can only eat mostly the diet that's available to you. What food can you get to readily with the transportation you have, with the transportation system? what's the price point of the healthiest food? Is that food affordable? Right? People are, hello, Flint kind of coined food as medicine. We know during the water crisis, strong diets help to buffer the impact of the water crisis for children. But a lot of what people put in their mouths is dictated by what's in their pockets. Exactly. So again, these are structural and systemic, not individual level. So Flint, I think, is a good example of how to do both and how to have really strong programs, how to support individuals, but also how to do the kind of systematic structural changes that are needed and the policy changes that are needed so that people are in context where health and health behaviors are available for everybody.
Thank you so much. All right, Dr. Epper, we know you're here, and
yeah.
We're gonna come back to you if we get a minute, but we want to move to talking about advanced care planning. We talked about our partner at the Greater Flint Health Coalition doing some great work with the health department and other community partners to make sure that we have access to some additional resources and understanding. So Nicole Smith-Anderson is here with us today, a special projects director at the Greater Flint Health Coalition. And look at that great big smile. Now she's going to come and talk to us about advanced care planning. Good morning, Nicole. Good afternoon, Nicole.
Good afternoon, Yvonne. Thank you so much for allowing us to come talk about this today. So we're really excited to talk about advanced care planning, mostly because it doesn't sound like a very exciting topic, but it's a very, very important topic. And even more so because tomorrow is National Healthcare Decisions Day. And so this is really the opportunity to promote and encourage individuals to have those conversations about their medical care that they want to have towards the end of their life. So if we want to forward to the next slide, just to give a little bit of context about what advanced care planning is. So really, it's the process of planning for future medical decisions to be effective. In this process, we want to make sure that we're reflecting on our goals, our values, and our beliefs. So those can be personal goals, cultural goals, spiritual goals, understanding the possible future situations and decisions. So lots of different things could happen, and we like to try to plan as well as we can. And then also making sure that we're discussing these decisions with those individuals that might have to carry out your decisions and carry out your medical plan. Go ahead and move to the next slide. So one of the key things that we do as part of our advanced care planning is making sure that we pick a patient advocate. And so that's going to be the individual that really helps make sure that your plans are being put into place. And I think this is an animated slide. There we go. So we want this person to be someone you can talk to and discuss your values and goals, willing to accept the role. That's critically important. We want to make sure that if there is an individual that you want to be in this role, that you have those conversations beforehand. It's certainly not anything that you would want to kind of appear out of nowhere. Make sure that they're able to follow your wishes and that they're able to make decisions in difficult situations. And one of the things that we've learned is this individual could be a wide range. So it's not necessarily your significant other. Maybe it's a sibling or a family member that you think might have more of an objective view when the situation occurs. Next slide, please. So why advanced care planning important? So we want to make sure that you're in charge of who your patient advocate is. No one else gets the decision. You get to make that in your hands. We want to make sure that healthcare wishes are known. I mean, that's something that I think we really learned during COVID is you had a lot of individuals that got sick very quickly and there was no end of life planning. And so making sure that these healthcare wishes that are in place is critically important. Again, unexpected things can happen. I think the COVID pandemic has really taught us that. It also reduces stress on your loved ones, and it allows individuals to be empowered to make those decisions. And so we really talk about advanced care planning as one of the best gifts that you can give your family members, because you're not leaving it up to them to decide on what you want. It's very clear and it's documented what your wishes are. Next slide. So to kind of support this project and process, we have a website, which is Your Health, Your Choice. And this is created and kind of managed not only by the Health Coalition, but also the hospital system. So we've kind of come together and decided this is the advanced directive we want to use. This is the curriculum that you want to use. And on this website, there's a ton of educational materials available. So we kind of have a starter guide that you can read through, help you get planning. There's all sorts of fact sheets. So, learning information about CPR and tube feeding, and there's a lot to it, but we really have done a good job of making sure that we're able to allow all this information to be easily accessible. one thing I do want to point out about advanced care planning is it's not something that you're going to do in 10 minutes, right? You're not going to sit down, fill out the form, and then be done with it. It's really something that we encourage people to take their time on, have conversations, maybe have conversations with both professional facilitators and then even family members to see, you know, what their experience is and how they really feel about the situation. Next slide. And one of the best parts about advanced care planning, especially locally, is through our health systems, we have been able to train quite a few advanced care planning facilitators. And so these are individuals that have completed a pretty lengthy training and are able to help individuals fill out their advance directive and really answer those questions that they have. And what's beautiful is that we're able to provide facilitations for free. And so if an individual goes to the yourhealthyourchoice.org website, scroll down a little bit, on the right-hand side, there's a request to seek an appointment. So if you fill that out, even if you have a specific preference for a health system, so say you're like, I always use, you know, Genesee or Hurley physicians, we can make sure that we connect you to that individual in the health system, just so that it's well connected. So kind of in summary, I would encourage everyone to have these conversations. If you're someone that celebrates Easter and you're around family members, definitely bring this up. I know it's not ideal, but we do want to make sure that we're having these conversations and know that there are lots of resources out there, and it's really the best gift that you can provide your family members. And so feel free to visit the website. There are lots of individuals in the community that are happy to help you in this planning process. So thank you.
Thank you so much, Nicole. And I want to just go back to something you said. This is a partnership, so the hospitals are involved in this. So can you just speak a little bit to, as a person does this, how this gets connected to what the hospitals, are they able to see or understand at all what the family is putting together based upon what they pull together? Okay, you're on mute.
There we go. Yeah. So one of the key things is when you complete your advance directive, we want to make sure that copies get to all the appropriate places, right? So your primary care physician should have one. Also, hospitals are able to have access to them as well. So that is definitely a critical component, right? It's no good if you have your advance directive done and it's just sitting in a drawer in your kitchen, right? So we're able to make sure that it kind of lands in a couple different places, just so then that information is readily available. And that's a great thing to point out, Yvonne, just because, you know, we want to make sure that people, you know, ideally have a copy on their own, but then making sure that their patient advocate has a copy, and then even their primary care physician and then their health system as well. That's really important, just to make sure that individuals' wishes are known. And I will point out too, that it is possible that these change, right? So you could fill out your advance directive and then, you know, something happens and you decide I need to modify that, right? And so it's kind of a document that can transform over time. And so we do like people to kind of be mindful of that. So, hey, if you already have your advanced care directive done, maybe you use Healthcare Decisions Day as the opportunity to review it, making sure that your feelings and your thoughts align with what you have done on paper.
Yeah, you must have been reading my mind, Nicole, because that was going to be the next question that I was going to actually ask you. Because literally, I had a conversation with someone just a few hours ago, and they were saying they had their loved one had everything all written out. And just a few days before, and they weren't even anticipating the passing, but just a few days before, she just decided she wanted something altogether different. And so, you know, people do, the circumstances change. So we want our community members, again, know how important their voice is. And as community health workers and social workers, these are things that you can help facilitate, and just in that conversation, how important the voice is of that family member, and connecting with those primary care physicians and other healthcare workers that will help facilitate the process. Because these are not easy discussions. No one wants to think about a loved one dying.
No, not at all. And I think that there's a fair amount of stigma, but we plan for vacations, we plan for retirement, we plan everything. And this is the one thing that we don't spend enough time planning. And I think individuals just knowing that there are resources available, it's something that we are here to support. And really, it's critically important for many, many reasons. And I will also add, I know that there are a lot of social workers and CHWs on the call, the Health Coalition annually does a facilitator training. So if this is something that you would be interested in, maybe, gaining a certificate in it, we can certainly support that. We usually do that in the fall. But it's a really nice opportunity, especially if you're working in a space where you're having those opportunities to have those conversations. We can kind of set you up with that advanced curriculum.
Thank you, Nicole. Now, we've had some individuals, they've joined us by phone. So I'm going to just ask you to give a phone number in case they want to give you a call.
Yep, absolutely. You can give us a call at 810-232-2228, and you can ask for me, and I'm happy to kind of get you connected with whatever resources that you need.
Okay, I'm going to ask you one more time.
Yeah, ready?
Because somebody was getting their pencil. I just feel them. They were trying to scramble for that pencil.
Right. Okay, ready? Okay. Yep. 810-232-2228.
Thank you so much, Nicole. You're appreciate this. And again, you say tomorrow is Advanced Care Planning Day.
Yes.
Families
Spend that
are
time with your family, have those conversations, visit the website, yourhealthyourchoice.org. You can pull down fact sheets. They even have a guide to kind of start the conversation. So if you're unsure of how to broach the topic, we have lots of resources available to help.
Okay. A quick question, just can you talk about health power of attorney too?
We can, and I don't have the fact sheets in front of me, so I don't want to say anything incorrect, but we have that information available on the website.
Okay, so great. Thank you again, Nicole. Appreciate you sharing with us today. And it's really a good segue when we talk about advanced care planning, talk about sharing with our healthcare providers. It's important that we have some additional insights. So we do have Dr. Susan Wolford here, who is going to give us our medical moments for today. Dr. Wolford.
Hi, Yvonne. Thank you so much for this opportunity to share today on the medical moment. So I am going to talk today about chronic illness because we know that plays a role in our ability to fight COVID and some of the problems that we have when we get COVID. So today we're going to start out with the chronic illness of diabetes. I know many of you are familiar with it, but what I'm going to do is we're going to go back a little bit to basic physiology, think about what causes diabetes, and then what we need to do about it. So if we go to step one, the first thing, it starts off with us eating something. Now, I purposely didn't put a sugary treat here because people, when they think about diabetes, often think about just the sugary things. But really, it's any food that is changed into sugar in our body that relates to diabetes. And so carbohydrates, such as this tasty looking pasta, would also change into sugar in our body and is pertinent to diabetes. So we eat that food and it comes down into the stomach and then into the small intestines. And all of that, in that process, the digestion occurs. It starts in our mouth when we start chewing it, and then there's more digestion in the stomach, and then into the small intestines, where, if we look closely at the small intestines, the lining of it looks like this, little fingers, very thin fingers, with very thin layer of cells along the edges. And that is where the absorption occurs. And so it has to be a very thin layer, because what happens is that sugar that is now there from the food that we ate, that has to make it across those thin cells into our blood vessels. And so it gets absorbed into our blood vessels, and now we have sugar in our blood. You think, what's the problem with that? Well, the thing is, higher levels of sugar in the blood is actually quite toxic to us. And so our body sends out an alert, an alarm. Oh my goodness, we have to do something about it. Too much sugar in the blood. And it sends that signal to our pancreas, that little yellow object there just below our stomachs. That the pancreas now makes what many of us have heard about, it makes insulin. And let's think of these little figures as insulin. That insulin, its job is to move the sugar from our blood vessels, where it really can't do much for us, into our cells where we can use it for energy. Now, anybody who's been coming to the webinar very often, you're really very familiar with receptors, right? You remember hearing about ACE2 receptors that open the cells and let the COVID in. Well, we have receptors, different kinds of receptors on our cells, and these are insulin receptors. So today we're talking about insulin receptors on our cells. The insulin works like a key. It unlocks the cell and lets that sugar move into our cells where we can use it for energy to be able to run, work, and play. So, what is diabetes? Diabetes occurs when there is a problem with that insulin. Either our pancreas is not making enough insulin to get the job done, or it's no longer able to open those cells. And so therefore, the key is not working well anymore. And as a result, that sugar stays in the bloodstream rather than getting into our cells. So then, when we test our blood sugar, we get levels that indicate that maybe there's a problem. And here we know that's what diabetes is. That sugar in the blood is too high, and it can't get into the cells. And so we're able to test our blood and we're able to find out. Now, the thing with diabetes is that I'm mentioning this because African American Health Month. As African Americans, we often get diabetes at a younger age and suffer from more complications than Caucasians in the US. We also are more than 2 times more likely to have our legs amputated because of diabetes. And we're 3 times more likely to be hospitalized due to uncontrolled diabetes. So why am I talking about uncontrolled diabetes? Because uncontrolled diabetes and diabetes when you don't know it, and this is the other fact I want to mention here, that 1/4 of those with diabetes don't know they have it. So if you either don't know that you have it or you have uncontrolled diabetes, your risk of having severe outcomes from COVID are multiple times more than people who either are controlling their diabetes or don't have diabetes at all. So what are the things that you can do to help keep yourself safe in regards to COVID and diabetes? Well, first of all, know if you have diabetes. So you need to go and get tested. I was told that maybe my blood sugar was creeping up. So I went out. It's very easy to get. Ordered a set online, checked my blood sugar to find out what it is and to make sure that it's staying within the normal range. I would suggest that you go to your primary care doctor, get tested so that you can know whether or not you have diabetes. Think about your family history. Are there people in your family? If this is such a prevalent illness, either diabetes, it's so common, either diabetes or pre-diabetes, like on the road to diabetes, 1 in 3 people in the US have it. So look around your household, look left, look right, look around your workplace. You're sitting in church, look on the pew you're sitting on. If there are 3 people there, likelihood is 1 of you has diabetes or pre-diabetes. If it's you, you want to take care of that. So very quickly, get tested. If you have diabetes, monitor your blood sugar, manage it really well because that makes a difference in severe outcomes. And we can intervene. We can change what we put into our bodies so it's not as likely to have put so much sugar into our bodies. And of course, as you know, I'm going to say, that's vegetables and the healthy foods, green foods. Fruit will elevate your blood sugar, but it's better than many of the other processed foods that we get. So That's my medical moment for today. Make sure you know whether you have diabetes or whether you have prediabetes. And if you have it, manage those sugars well. Test your blood sugar well, frequently, so that you can keep it controlled, and therefore you'll be less likely to have a severe outcome from COVID.
Well, Dr. Wolford, thank you, but I need to just ask you a couple of quick questions here, because you said frequently, and I don't want to forget testing. I feel like, my daughter says they're seniorly moments, and Dr. Deborah was saying they're COVID long haul moments with that brain fog. So I don't want to forget talking about testing. But when you say frequently, what does that mean? Every day, once a day, twice a day?
Right. So that's going to vary depending on where you are in this process, right? So if you have a diagnosis of diabetes, then you need to speak with your provider and determine how often that level should be measured. For some people who are taking insulin, they actually have continuous monitoring. So they have a monitor that is embedded in them, and they can continuously monitor it so that they can know when it's time to eat, whether they need to drink some water, what happens when they exercise. So they can continuously know that. The greater amount of data you can collect so that you can keep your blood sugar within a healthy range for you, then the better it is. Because what happens is when our blood sugar, it doesn't stay within the healthy range, it damages our organs. And that is why diabetes leads to blindness and kidney disease and losing our toes and our legs. It's because we've allowed the blood sugars to stay at high levels for periods of time. And so that's what we want to avoid. So as frequently as you can monitor it, you should.
So we're talking about here, again, one of the questions I was asked, why so much emphasis on COVID and not the chronic diseases which we've been continuing to suffer with? So thank you for bringing this to light. But can you also, in this quick conversation, what's a normal blood sugar?
Right. So if you have a blood sugar, depends on whether you've eaten something or if you haven't eaten something. So if you haven't eaten something, if you are fasting and you get a blood sugar and it's above 100, then we're in that pre-diabetes range, and you need to speak. The doctor will talk with you about trying to keep it down. So we want to keep it less than that. If it's over 125, then we're really moving into more concerning ranges, and so you definitely want to speak to your doctor about that. Now, we don't want, for diabetics, if you actually have diabetes, we don't want it to get too low, right? So there is the risk of a very low, because as you know, people with diabetes may end up having hypoglycemic moments where their blood sugar drops. And that's dangerous. That's really very dangerous. So you don't want it to go less than 60. Yes, so fasting blood sugars. And that's the first step. Once we've gotten the fasting blood sugar and it's given us the sense there's a problem, there are more tests that your doctor will do to diagnose it fully.
So you're talking about testing, and I just have one more question, Dr. Wolford, because I think this is really important. I guess we see a lot of commercials now, more advertising different drugs, if you will, medicines. And so there's conversation about this A1C. Is that related to diabetes? This hemoglobin, they don't say hemoglobin anymore. We used to talk about hemoglobin A1C. And I often say, you can't hide from the A1C. So can you just give us a little bit of insight on that?
Oh, I'm so glad you asked that question. So if I take my blood sugar now with my little implement here, I'm able to tell what my blood sugar is at this very moment. But if I want to know how well I've done in controlling my blood sugar over the last 2 to 3 months, then I do my hemoglobin A1C. And that gives me a good idea of whether I've been keeping it under control or not. And so if you have a level of 5.7 or above, and some labs differ, but 5.7 or above, then you're in that pre-diabetes range, and you need to pay attention. And so that's what the hemoglobin A1C does. It helps us be able to monitor how well we're doing with managing sugar over a period of time. And it's to do with how sugar is bonded to our red blood cells, and our red blood cells are turned over every 3 months, and that's why it's that time frame. And you don't have to fast for it, because it doesn't really matter what you did 2
Get
seconds
high.
ago.
Get high.
Yeah, it's what you've been doing over the past 3 months. So the only way to change that is really changing what we do over time. And I want to mention something because you mentioned, and I was trying not to go over time, but if I have just a couple seconds, we've been talking about how diabetes impacts COVID, so that if you want to make sure you have a good, well-controlled blood sugar so you don't suffer from the severe effects of COVID. Interestingly, it appears that COVID actually might be causing people to develop diabetes. And part of those long haul symptoms that people are getting, some of them may be associated with an increase in diabetes in some people who've had severe courses of COVID.
So for the medical moment, let's end with, we want to make sure that the people understand there is a link either way. If you have diabetes, it puts you at greater risk for difficulties or complications of COVID. If you have COVID, it puts you at greater risk for some of these chronic diseases like diabetes. And again, we're still under this experimental learning about this. But then I want to ask you, doctor, to just give us those protocols. What should we do to make sure that we're doing the best to take care of ourselves as we end this segment?
Exercise. Exercise is one of the best ways to control insulin levels, whether or not you lose weight or not. Just engaging in the exercise, getting those muscle cells to work, that helps to control it. What we put into our body, put in things that are not going to turn so readily into such a amount of high sugary foods that spike our insulin levels. We really don't want that. Eat things with a lot of fiber. I had my apple here, but I don't think I ate it. Oh, here we go. Here's the apple. Things that are not going to spike your blood sugar. Use things that are going to give you fiber to control your blood sugar, exercise, and sleep.
Well, we're not going to talk about the sleep, doctor, but we know we need it. I just want to touch it. There's one quick question in the queue. Can you talk about how prediabetes for a long time is also not good for cardiovascular disease or heart disease? And that's another chronic illness, but we're going to keep coming back to these, but just quickly touch on that, doctor.
Right. So remember, I'm saying that this increased level of sugar in our body damages our cells. And so it damages organs, our heart, our kidneys, all of our organs are damaged by that higher level of blood sugar. And even if we haven't crossed into frank outright diabetes, if we're pre-diabetic, then we have a higher level of sugar than we should in our blood vessels. And so it is doing some damage. And so the pre-diabetes doesn't mean hang out here, you're okay. It means get it down. It means take action now. Remember that alert sign I showed in the pictures? It's alert, make a change now so that you can avoid high blood pressure, heart disease, kidney problems.
And the list goes on, right?
And the list goes on.
And so one of the things we said often in our community conversations around this is when you hear prediabetes, just act as if you have it and do all those things to prevent it, because it simply means at that point, you're not taking meds to reduce it, but you still need to do some other things. So we're running out of time for this segment, but I want our listeners to know we're going to continue based upon the request to talk about chronic diseases and COVID, because we're learning about this interchange that's happening as a result. So thank you, Dr. Wolford. We have just a few more moments and we're going to cover a couple of things. Again, I said we're having a little skeleton crew today. And so our health department sent us some information because they're not able to be here with us today in recognition of Good Friday. They are off today. And so for those of us that are celebrating today, I'm going to do my thing right after this webinar. But we want you to know, thank you, Ashley, for sending us these slides. We just want to make sure we know about vaccines, testing sites, and update. This is really important. As Dr. Wolford talked about testing for diabetes, it's so important that we have the opportunity to do these tests so we can get some advanced notification. But if you are concerned about not getting COVID in a severe manner, you want to be able to utilize these resources that we have. Those regular sites are still available. Every day of the week, there is an opportunity for us to get a vaccination if you are interested in getting one. So Macedonia is still open. There's a pop-up on the 19th this week at Our Lady. And then the weekly sites will be Word of Life and then Bethel United Methodist Church. There's a pop-up on Wednesday of the following week on the 27th at Central Church of the Nazarene. And then those weekly sites will also be available at North End Mini Station, the Word of Life Church, and Bethel United Methodist Church. So those are regular sites. Please make sure that people know about those. Thursday and Friday coming up, as the health department has mentioned to us, there are going to be some different times. So there'll be a pop-up clinic on the 21st at Shiloh. And then there will also be a pop-up clinic coming next week at El Shaddai Ministries. Shiloh is at 2120 North Saginaw Street, and El Shaddai Ministries is at 920 Walnut Street. This is a new pop-up site for us. And then on Friday of next week, the regular sites of South Flint Plaza will have a clinic, and then Macedonia, and then there will be a pop-up on the 29th at Hasselbring Senior Center. One of the reasons for these pop-ups is to give additional opportunities for our community members to get vaccinated if you should want to. And I say should because there's conversations about people having reservations. One of the big questions came up early on as an equity issue is it available and accessible for everybody? So our partners are gathering together to ensure when you make that decision, the opportunity is available to you. In addition to that, we want you to be sure to get tested. Just like Dr. Wolford just talked about testing for diabetes, we need to continue to test for COVID. Now, here's the thing, as we're talking about this recovery, this process, here's the thing we want you to know. The way we used to initially, when this started off, people had high fevers. They were really, really sick. And this was a way we could just do this little checklist and see if you had these symptoms, then you wouldn't go out. You go and maybe do some other things. But now, as Dr. Deborah mentioned in her experience, she didn't have all of those extra kind of high alert symptoms. And yet the virus was still there. So we want you to go to these testing sites and get tested. Rapid antigen tests are performed at all of these sites. No insurance is required. No doctor's appointment is needed. And there are two types of tests. You can get the saliva test, or you can get the nasal test. Word of Life, Bethel United Methodist Church, and Macedonia Missionary Baptist Church are still places that are available in community every day of the week, Monday through Friday. Now you'll need to look at these sites and see which ones, but we want you to go to these sites. They prefer you make an appointment, but I will say to you right now, walk in, you don't have a long wait because people are reducing their number of times they're getting tested and the number of people that are getting tested. But we want to encourage you, please go to these sites and get tested. We don't want to lose these opportunities in our communities. If you can't get to one of the church sites, Walgreens on Davison Road is still doing testing, as well as Hamilton Community Network. And in each case, no insurance is required because they really want to make sure that everyone gets tested. Walgreens is testing for children 3 years and above. And these are self-administered. So we want you to know, no barriers. We're trying to reduce all barriers. You've helped us with that. So continue to help us to get this word out. Testing and vaccinations are important. And therefore, we, again, in an effort to make it easy for you, drive-through vaccine event will be held next Thursday, the 21st from 3 to 6 p.m. at the Genesee Health Plan. If you don't want to get out of your car, just drive up, roll down your window, roll up your sleeve, and we'll be partnering with the Genesee Community Health Center to provide those vaccinations for you. In addition, and Katie Baxter brought this to our attention, there's been an increase in substance abuse, and we've seen some additional unfortunate deaths as related to that. So they will also be providing a naloxone training or Narcan. That's a basic training provided for Genesee Community members who want to know how to help avoid opiate overdose. You can come on the 21st between 3 and 6 at the health plan and get that information. This will all be provided by the Genesee Community Health Center with a partnership with the Genesee County Influenza Immunizations Partnership, along with the Genesee Health Plan. So that's another opportunity for us in our community. And if you want to get tests for your home, the Greater Flint Health Coalition has free over-the-counter COVID-19 tests available for Genesee County residents if you need them. If you need them, please call them and get the information. That number to call is 810-953-2427. For those of you that are listening by phone and you want free tests for your family, community members, community organizations, call the Health Coalition, and you can also get referrals to CHAP. CHAP will help you navigate some of the programs and services that you might need. We're just doing everything we can in this community to make this information available to you. Remember what we said about this webinar, the local context to a global pandemic. What's available here? The organizations that you see here are doing our best to make sure you get the information that you need. And let's go further and tell you what else is happening with the city of Flint. This update, Kiana is not with us today, but she sent these updates. So we're going to provide quickly these updates from the city of Flint. City of Flint is still on the move. And so here's what they're saying. Today is closed. The City Hall is closed for Good Friday. But if you need to drop some information off there, especially the water payments, they still have their drop boxes available outside of the doors of City Hall. Drop off any information that you might need. There's a lot of Easter egg hunts going on this weekend, including the city of Flint has one at City Hall from 11 to 1 p.m. with the mayor, the fire department, the police department, games and activities. And they didn't give us the date for that. So, but that's at City Hall. I think it's today. On Sunday. City is going to go back to the water blend 95.5. What that means is 95% of our water will come from GLEWA, which is the Great Lakes Water Authority, and 5% of the water will come from the Genesee County Drain Commission as the secondary water source. Now, if you want more information about this, the Water Services Advisory Committee will the Water Services Advisory Council will have their meeting on Monday night in the Dome. And so if you want more information, and as a community resident, you're welcome to come to that open public meeting to share information and ask your questions so that there could be some advocacy there. The administration has successfully worked with 600 unions on a new contract. The first negotiated contract is almost 10 years old, 10 years and 6 years. So that is going forward as well. And additionally, the Economic Development Department reminds small businesses to participate. Small businesses participate in the Shop Flint Immerse store. Business can add services and products at this website. I'm going to read it for those of you that are listening. It's https://flint.shopwherelive.com. This is an Economic Development Department e-commerce store for small businesses. You can learn about small businesses in Flint and shop Flint. The encouragement is help build our organizations, our businesses here in the city of Flint. If we do this, we can build our city. Working together collectively, we can make a difference. We're just about out of time today. So I'm going to tell you what I tell you every week. I'm sorry, I forgot. The mini stations for the city of Flint are still open. The North End mini station and Dordt Mall, I think we mentioned those earlier. They're still available for you to get vaccinations and testing. So as we wrap up today, I want to appreciate those of you that are community health workers and social workers. And you're asking about the continuing education units and the contact hours. This is very, very important. We work really hard every week to make sure we provide credible information for you, and so that you can get these contact hours and the social work credits. Please wait just a little bit after the session today so you can click on that survey and make sure you get your document completed so that you are eligible for these credits. If you do that, I think you'll like the results. So sign up for the health equity brief as well. This is still available for us. Sign up for the health equity brief. That's in the chat. I want to thank you today for joining this webinar. Every week, again, you make the difference. We appreciate those of you that join us by Facebook, so continue to like us on Facebook at the HFRCC Facebook page, facebook.com HFRCC. Join or subscribe to our Healthy Flint YouTube channel, and always feel free to email us at info@hfrcc.org. If you don't want to do any of those and you just want to pick up the phone, give us a call and leave us a message, give us a call at 810-835-2130. And we'll look forward to seeing you next week for session 110, session 110. So again, thank you for joining us today. This is the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. Thank you and enjoy this weekend.